Well, as you know, the Arizona State Legislature passed a bill last session which charged the Arizona Department of Health Services with looking at the scope of practice and the way for licensed professional midwives in Arizona and the way we administer those licenses. And so we've got some stakeholder meetings that we've been working on over the last few months. The next stakeholder meeting, it's actually a committee meeting, will be this Monday at the Arizona State Laboratory. We'll be tweeting live updates from the Midwife Scope of Practice Advisory Committee. Again, it's on February 11th from 5 to 8, and you can join the conversation on Twitter using the hashtag AZMidwives. Well, up to this point, many of our advisory committee meetings have been really going through some of the details of what we're thinking about as we draft the new proposals to license and regulate midwives. And this will be kind of a unique meeting on Monday night because we're going to have a lot of presentations. So for example, a couple of consumers will be giving their perspective. I think we've got some nurses that are going to give a perspective from sort of that nursing viewpoint. So this meeting is going to be a little bit different in that it'll be more presentation heavy. We've also left 45 minutes at the end of the agenda just so the public will have more time to talk about and give us some input, just from the general public, because the meetings up to this point have been compressed. They've only been 2 hours long. This one will be 3, and we're going to use that last 45 minutes to get more robust input from the public. Well, there is no shortage of opinions on what the scope of practice should be for licensed professional midwives in Arizona. I mean, I've been in state government a long time, and seldom do I see a stakeholder group that has such disparate opinions about what should be available. The consumers really are looking for a pretty broad scope of practice, much broader than the current scope. The medical community is a little bit skeptical because they've seen some bad outcomes in some of their facilities. And so the purpose of this committee is really to get input to the department and specifically to me, so that at the end, and as we make decisions about the final scope of practice, that I'm hearing a wide range of opinions around what folks think the scope should be, and importantly, I'm looking for the why. What does the data show? And one of the things that we'll be looking for in the next few weeks is a report that's due from the U of A College of Public Health, where they've done a literature review of scope of practice issues with licensed professional midwives, and looking at the published literature so that we can get a real handle on, what are the real risks? What really are the risks if we expand the scope to include breech births? What would be the real risk to the mom and the baby if we were to allow vaginal births after cesarean in a home setting with a licensed professional midwife? So I'm really interested in that data set, but I'm also interested in hearing from stakeholder groups, not just folks on the committee, but folks in the audience, and that's why we've carved out 45 minutes on the agenda. The other way folks can contribute, even if they can't participate in the meeting on Monday and in the future meetings, is we've got the ability to make comments online. So you could just go to our azdhs.gov website, do a search on the Midwife Advisory Committee, and there's a way for you to sort of just contribute electronically as well. Yeah, the Department of Health Services will be tweeting live updates from the Midwifery Scope of Practice Advisory Committee meeting this Monday. It's on February 11th. It's from 5 to 8 o'clock. And you can join the conversation on Twitter using the hashtag AZMidwives.